1. What is the priority nursing action for a patient with acute chest pain? A. Administer oxygen. B. Obtain a 12-lead ECG. C. Give sublingual nitroglycerin. D. Assess pain level. Answer. A. Administer oxygen. Rationale. The priority in a patient with acute chest pain is ensuring adequate oxygenation to reduce myocardial ischemia. Oxygen should be administered first, followed by ECG monitoring and medication administration. Pain assessment is important, but not the first priority. 2. A postoperative patient is experiencing decreased urine output, 20 milliliters per hour. What is the priority nursing intervention? A. Encourage oral fluids. B. Notify the healthcare provider. C. Assess for bladder distension. D. Administer for fluids. Answer. C. Assess for bladder distension. Rationale. Urinary retention is a common post-operative complication. The nurse should first assess for bladder distension before deciding on further interventions. Notifying the provider is important, but should follow assessment. 3. A patient with COPD is receiving oxygen therapy. Which oxygen delivery method is most appropriate? A. Simple face mask. B. Non-rebreather mask. C. Nasal cannula at 2 liters per minute. D. Venturi mask at 50% VO2. Answer. C. Nasal cannula at 2 liters per minute. Rationale. COPD patients have a hypoxic drive to breathe. High oxygen concentrations can suppress their respiratory drive. A low-flow nasal cannula, 1 to 2 liters per minute, is the safest option. 4. A nurse is caring for a patient receiving furosemide for heart failure. Which lab value should be monitored closely? A. Sodium. B. Potassium. C. Calcium.
D. Magnesium.
Answer. B. Potassium. Rationale. Furosemide is a loop diuretic that causes potassium loss. Hypokalemia can lead to arrhythmias, making potassium monitoring essential. 5. A diabetic patient is unconscious with a blood glucose level of 42 milligrams per deciliter. What is the priority nursing action? A. Administer glucagon I. B. Give orange juice. C. Recheck blood glucose in 15 minutes. D. Notify the physician. Answer. A. Administer glucagon IM. Rationale. In an unconscious hypoglycemic patient, oral glucose is not safe. IM glucagon is the appropriate emergency treatment. 6. A patient with pneumonia is receiving 4 antibiotics. Which nursing intervention is most important? A. Monitor for allergic reactions. B. Encourage increased fluid intake. C. Assess lung sounds every shift. D. Encourage deep breathing exercises. Answer. A. Monitor for allergic reactions. Rationale. For antibiotics can cause severe allergic reactions, e.g., anaphylaxis. Monitoring the patient closely after administration is crucial. Other interventions are also important, but not as immediate. 7. A nurse is preparing a patient for surgery. Which action is most important? A. Ensure the patient is NPO. B. Obtain informed consent. C. Administer pre-op antibiotics. D. Verify allergies. Answer. B. Obtain informed consent. Rationale. The surgeon must obtain informed consent before surgery. The nurse ensures it is completed before proceeding with other pre-op preparations. 8. A patient has a deep vein thrombosis, DVT, in the right leg. Which action should the nurse avoid? A. Elevating the leg. B. Applying warm compresses. C. Massaging the leg. D. Administering heparin. Answer. C. Massaging the leg. Rationale. Massaging a leg with a DVT can dislodge a clot, leading to a pulmonary embolism. Other options are appropriate interventions. 9. A patient with cirrhosis has ascites. What is the priority nursing assessment? A. Daily weight. B. Breath sounds. C. Abdominal girth. D. Fluid intake. Answer. B. Breath sounds. Rationale. Ascites can cause respiratory distress by increasing abdominal pressure on the diaphragm. Monitoring breath sounds is the priority. 10. A patient with hyperkalemia has peaked T waves on ECG. What is the priority nursing action? A. Administer sodium polystyrene sulfonate. B. Prepare for dialysis. C. Administer for calcium gluconate. D. Give loop diuretics. Answer: C. Administer for calcium gluconate. Rationale: calcium gluconate stabilizes the myocardium, preventing fatal arrhythmias. Other interventions lower potassium levels, but take longer to act. 11. A patient with a history of hypertension is prescribed atenolol. What is the priority assessment before administration? A. Blood pressure. B. Respiratory rate. C. Blood glucose level. D. Urine output. Answer: A. Blood pressure. Rationale: atenolol is a beta blocker that lowers blood pressure. Assessing BP before administration prevents hypotension. 12. A patient with a peptic ulcer reports sudden severe abdominal pain and rigid abdomen. What is the priority nursing action? A. Assess vital signs. B. Administer pain medication. C. Prepare for surgery. D. Insert a nasogastric tube. Answer: A. Assess vital signs. Rationale: sudden severe pain and rigidity suggest perforation, a medical emergency. The nurse should assess vital signs for shock before taking further steps. 13. A patient receiving warfarin has an INR of 5.2. What is the priority nursing intervention? A. Hold the warfarin dose. B. Administer vitamin K. C. Check for signs of bleeding. D. Notify the provider. Answer: B. Administer vitamin K. Rationale: an INR above the therapeutic range increases bleeding risk. Vitamin K reverses warfarin's effects. Checking for bleeding and notifying the provider are important but secondary. 14. A post-op patient reports nausea after receiving morphine. What should the nurse do first? A. Stop the morphine. B. Administer an antiemetic. C. Lower the head of the bed. D. Encourage deep breathing. Answer: B. Administer an antiemetic. Rationale: nausea is a common opioid side effect. Antiemetics can prevent discomfort without stopping pain management. 15. A nurse is caring for a patient with Cushing syndrome. Which finding is most concerning? A. Moon face. B. Hypertension. C. Dependent edema. D. Low potassium. Answer: D. Low potassium. Rationale: hypokalemia can cause serious cardiac complications and must be addressed urgently. Other findings are expected in Cushing syndrome. 16. A patient with liver failure has a serum ammonia level of 85 micrograms per deciliter. What medication should the nurse anticipate? A. Lactulose. B. Furosemide. C. Spironolactone. D. Metronidazole. Answer: A. Lactulose. Rationale: lactulose reduces ammonia levels in hepatic encephalopathy by promoting excretion through the bowels. 17. Which finding is most concerning in a patient receiving forheparin? A. APTT of 50 seconds. B. Occult blood in stool. C. Mild gum bleeding. D. Ecchymosis at the fore site. Answer: B. Occult blood in stool. Rationale: occult blood suggests internal bleeding, a serious complication of anticoagulation therapy. Other findings are expected, but less urgent. 18. A patient with heart failure is prescribed digoxin. Which symptom requires immediate intervention? A. Nausea and vomiting. B. Heart rate of 62 bpm. C. Blood pressure of 110/70 mmHg. D. Ankle swelling. Answer: A. Nausea and vomiting. Rationale: nausea and vomiting can indicate digoxin toxicity, requiring immediate intervention. 19. A nurse is caring for a post-op patient with PCA morphine. What is the priority assessment? A. Pain level. B. Respiratory rate. C. Sedation level. D. Oxygen saturation. Answer: B. Respiratory rate. Rationale: Opioids can cause respiratory depression. Monitoring RR ensures patient safety. 20. A patient with DKA has rapid, deep respirations. What is the correct interpretation? A. Normal response to metabolic acidosis. B. Sign of respiratory failure. C. Indication of worsening condition. D. Early sign of sepsis. Answer. A. Normal response to metabolic acidosis. Rationale. Kussmaul respirations are the body's way of compensating for metabolic acidosis by eliminating CO2. 21. A nurse is teaching a patient with GERD about dietary modifications. Which food should the patient avoid? A. Baked chicken. B. Whole wheat toast. C. Citrus fruits. D. Scrambled eggs. Answer. C. Citrus fruits. Rationale. Citrus increases stomach acid and worsens GERD symptoms. 22. A patient with tuberculosis is on isoniazid therapy. What is a key side effect to monitor? A. Hepatotoxicity. B. Renal failure. C. Hypoglycemia. D. Bradycardia. Answer. A. Hepatotoxicity. Rationale. Isoniazid can cause liver toxicity. Liver function tests should be monitored. 23. Which finding suggests increased ICP in a patient with a head injury? A. Bradycardia. B. Tachycardia. C. Hypotension. D. Decreased urine output. Answer. A. Bradycardia. Rationale. Cushing's triad, bradycardia, hypertension, irregular respirations, is a sign of increased ICP. 24. A patient with pancreatitis is receiving total parenteral nutrition, TPN. What is the priority assessment? A. Blood glucose levels. B. Abdominal pain. C. Lung sounds. D. Urine output. Answer. A. Blood glucose levels. Rationale. TPN contains high glucose, increasing the risk of hyperglycemia. 25. Which assessment finding suggests an anaphylactic reaction to penicillin? A. Urticaria and wheezing. B. Nausea and vomiting. C. Headache and dizziness. D. Low-grade fever. Answer. A. Urticaria and wheezing. Rationale. Urticaria, hives, and wheezing are signs of anaphylaxis, requiring immediate intervention. 26. A patient with Addison's disease is at risk for which electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypocalcemia. Answer. A. Hyperkalemia. Rationale. Addison's disease causes adrenal insufficiency, leading to high potassium and low sodium. 27. A nurse is preparing to administer for vancomycin. What should be monitored? A. Red man syndrome. B. Ototoxicity. C. Hypotension. D. All of the above. Answer. D. All of the above. Rationale. Vancomycin can cause red man syndrome, ototoxicity, and hypotension if given too quickly. 28. A patient with DVT is on enoxaparin therapy. What is a concerning finding? A. Dark stools. B. Bruising at the injection site. C. Mild epistaxis. D. Elevated APTT. Answer. A. Dark stools. Rationale. Dark stools may indicate gastrointestinal bleeding, a serious complication of anticoagulant therapy. 29. A nurse is monitoring a patient with Guillain-Barré syndrome. What is the priority assessment? A. Respiratory status. B. Deep tendon reflexes. C. Blood pressure. D. Urine output. Answer. A. Respiratory status. Rationale. Guillain-Barré syndrome can lead to respiratory paralysis, making airway assessment a priority. 30. A patient receiving chemotherapy has a WBC of 1/500/mm superscript 3. What is the priority intervention? A. Initiate neutropenic precautions. B. Administer antibiotics. C. Monitor for bleeding. D. Assess for nausea. Answer. A. Initiate neutropenic precautions. Rationale. A WBC count below 4,000/mm superscript 3 increases infection risk, requiring strict precautions. 31. A patient with COPD is receiving oxygen therapy. What is the recommended oxygen delivery method? A. Simple face mask. B. Non-rebreather mask. C. Nasal cannula. D. Venturi mask. Answer: D. Venturi mask. Rationale: the Venturi mask delivers precise oxygen concentration, preventing CO2 retention in COPD patients. 32. A nurse is assessing a patient with myasthenia gravis. Which finding requires immediate intervention? A. Drooping eyelids. B. Difficulty swallowing. C. Muscle weakness. D. Fatigue. Answer: B. Difficulty swallowing. Rationale: dysphagia increases the risk of aspiration and respiratory distress in myasthenia gravis. 33. A patient with chronic kidney disease has a potassium level of 6.2 milliequivalent/L. What is the priority action? A. Administer sodium polystyrene sulfonate. B. Restrict dietary potassium. C. Monitor for ECG changes. D. Prepare for dialysis. Answer: C. Monitor for ECG changes. Rationale: hyperkalemia can cause life-threatening arrhythmias, making ECG monitoring a priority. 34. A patient with cirrhosis has ascites. What intervention should the nurse anticipate? A. Encourage high protein intake. B. Administer diuretics. C. Monitor for hypoglycemia. D. Restrict sodium intake. Answer: D. Restrict sodium intake. Rationale: sodium restriction reduces fluid retention and controls ascites in cirrhosis. 35. A patient with rheumatoid arthritis is prescribed methotrexate. What is the key nursing consideration? A. Monitor liver function tests. B. Assess for hyperglycemia. C. Monitor potassium levels. D. Assess for tinnitus. Answer: A. Monitor liver function tests. Rationale: methotrexate can cause hepatotoxicity, requiring regular liver function monitoring. 36. A nurse is educating a patient with a new ileostomy. What should the patient avoid? A. High-fiber foods. B. Low-fat dairy. C. Lean proteins. D. Cooked vegetables. Answer: A. High-fiber foods. Rationale: high-fiber foods can cause blockage in a new ileostomy. 37. Which assessment finding is most concerning in a patient with meningitis? A. Photophobia. B. Nuchal rigidity. C. Decreased level of consciousness. D. Fever. Answer: C. Decreased level of consciousness. Rationale: a decreased level of consciousness indicates increased intracranial pressure, a life-threatening complication. 38. A patient with a history of peptic ulcer disease reports sudden, severe abdominal pain. What should the nurse do first? A. Assess bowel sounds. B. Check vital signs. C. Administer antacids. D. Encourage oral fluids. Answer: B. Check vital signs. Rationale: sudden severe pain may indicate perforation, requiring immediate assessment of hemodynamic stability. 39. A patient receiving heparin has a PTT of 120 seconds. What is the priority nursing action? A. Stop the heparin infusion. B. Administer protamine sulfate. C. Prepare for emergency surgery. D. Increase the heparin dose. Answer: A. Stop the heparin infusion. Rationale: a PTT of 120 seconds is dangerously high, increasing the risk of bleeding. Stopping heparin is the priority. 40. A nurse is caring for a patient with Cushing's syndrome. Which finding requires immediate intervention? A. Moon face. B. Dependent edema. C. Crackles in lungs. D. Purple striae. Answer: C. Crackles in lungs. Rationale: crackles indicate fluid overload, which can lead to pulmonary edema and respiratory distress.